Welcome to the Plastic Surgery Podcast, where we talk about all topics relating to plastic surgery. I am Philemon Vianis. That is Dr. Lambros Vianis to my left, to your right, if you are a viewer. This week, we are going to switch back to cosmetic surgery, and we're going to be talking about liposuction. So, Dr. Vianis, what is liposuction?
Well, it is a procedure used to remove fat. We use a cannula, which is a hollow tube that has a hole at the end, or maybe a few holes at the end, with suction that actually sucks the fat out through small incisions in the skin.
How often is liposuction performed?
Well, it's actually the most common cosmetic procedure performed in the United States.
Really?
Yes.
The most common.
Yeah,
okay,
most
wow.
common.
Can you liposuction pretty much anywhere on the body, or are there certain restrictions?
There are areas that you can liposuction pretty much anywhere in the body, in the face, the neck, the chest wall, the abdominal wall, the back, and your upper arms and your legs as well.
But is there any part of the body that's completely off restriction for liposuction?
There are areas that you want to avoid liposuctioning, and the reason is that there may be areas that don't require
liposuction. Is there any situation where you would say, okay, I'm not doing this part of the body that could theoretically be liposuction? Or is it, if there's fat there, it can be liposuction?
Correct.
Anywhere you can technically do liposuction.
That you can remove it.
Right.
Yes.
How exactly is liposuction performed?
So what we do is the area for liposuction is marked, and then the patient is taken to the operating room where they undergo the operation under either sedation or general anesthesia. Now, if there is a localized area which is relatively small, we can actually perform this procedure under local anesthesia with the patient fully awake. But typically, most of the time, the procedure is done with some type of sedative or general anesthetic just to make it more comfortable for the patient.
And when you say sedative, do you mean that they're completely asleep?
No, they are awake enough to be able to breathe.
Okay.
And there are different levels of sedation.
Right.
Some of that are just barely enough to just to take the anxiety away from the procedure.
Okay.
Others are deeper to the point where they're almost to the level of general anesthetic.
And
they're completely asleep.
Right. Does it depend on the patient, or does it depend on the procedure?
It varies on the procedure and how much liposuction you're going to perform.
So I assume that if you perform a lot of liposuction, you probably are going to sedate them completely.
Or put them to sleep.
Right.
Yes. And then after they're asleep, then we prepare for the surgery. The operation is done through small incisions. We make the incisions in the strategic areas of the body or the face. And through those small incisions, we place a fluid into the fat layer. And this fluid is like salt water, and it also contains epinephrine, which is adrenaline, or it's a vasoconstrictor. In other words, it constricts the blood vessels to help reduce bleeding during the procedure, almost to the point where there's almost zero blood loss from this operation.
Really?
And so the fluid is pumped into the fat layer, and we allow it to instill into the fat for a few minutes. And then we follow through with cannulas, or the hollow tube with a hole at the end with suction, and we actually pull the fat out.
So it's like a vacuum, basically.
It's like a vacuum, right?
Relative to the skin layer, is the fat right under the skin layer, or where is it located?
So there are different levels of fat.
Right.
There's some fat underneath the skin layer. There's a middle layer usually, and one that's a little bit deeper, closer to the muscle. And you like to stay in the intermediate zone. Because if you go too superficial to the skin, you have an increased risk of developing contour irregularities in the tissues.
So like
and depressions,
right.
Exactly right. Whereas if you stay sort of in the middle layer, you can pull the fat out a little more safely. As you go deeper, closer to the muscle layers, then potentially you have a higher risk of entering the deeper planes of the muscle tissue, which you'd like to avoid. So you want to stay in the safe zone when you liposuction.
Which is like the middle zone of the fat
starting
layer.
there, you may have to take it up a little bit more superficial, a little further deeper, just to get the contour that you're looking for, and to try to plane the tissue out so that it's nice and smooth.
What are the indications for liposuction?
So some of the indications are obviously to remove the excess fat. And when we assess a patient prior to surgery, we like to find out what areas of fat they'd like to have removed and what their expectations are.
And when
what,
you say
what the results they're trying to achieve.
And when you say expectations, do you mean where on the body
exactly
they want the fat to be removed?
Right. So if there's a patient that has for example, excess fat under their neck here,
Right.
and they
want
present
to
for
remove.
liposuction, have it
Yeah.
removed, then you have to look at certain factors in the skin and its relationship to the rest of the face. When we do the liposuction, one of the things we'd like to do is look at the rest of the body to see what the contour should look like.
Mm-hmm.
Almost like a 360-degree dimension. Looking at the abdomen, for example, what is its relationship to the rest of the body, like the hips, the thighs,
Mm-hmm.
the upper part of the torso?
Mm-hmm.
And then you decide about contouring and removing some of that fat. We also look at the elasticity of the tissues. If it's in the neck, for example, if you try to liposuction from the neck and remove some fat tissue, if the patient has very inelastic skin, that is not going to rebound after you remove the fat volume,
And when
then
you
you'll have hanging skin.
Oh.
Right.
So inelasticity means that it will hang.
Right.
Low.
So it's like a sock. If you have a new sock
Right.
and you pull it up on your ankle,
Right.
it hugs the
ankle.
the ankle, right?
Yeah.
But as the sock gets older and it loses elasticity, it tends to kind of
Sag
fall away.
down.
It sags down.
Yeah.
And the same thing with skin.
Oh.
So if someone who's younger or someone who has a good skin tone,
Yeah.
when you remove the fat tissue,
It snaps right back, right?
it'll
Just
snap
goes
back. Exactly, right.
Mhm.
It'll follow the contour of what you're looking for.
Mm-hmm.
So you have to assess how much rebound you're going to have following removal of the fat, because you're relying on that skin tone
Right.
to follow the contour of the body, because the body is not a flat board.
No.
It's a cylinder. The areas that you're liposuctioning, as I mentioned, is almost like a 360-degree dimension. So you're looking at, let's say, for example, the abdomen.
Right.
You're looking at the waistline and the areas that you're going to liposuction to improve the contour. Because the patient may show up and say, well, I don't like all this fat hanging from my abdomen. Well, that may not be the only area that needs to be liposuction. You may have to do the flanks to make things proportional
Right.
to the waistline to improve it. If the patient has inelastic skin that's not going to rebound adequately, then you may have to remove the skin. And you can also add liposuction to improve the contour with the rest of the body.
And will you suggest that too? Like if someone comes into you and says, I would like to reduce the fat around my abdomen, but you say, okay, if we do this, we're also going to need to liposuction these other areas. So will you suggest that
Yes.
and perform that?
Correct. If the area that is of concern is the abdomen,
Yeah.
if they have stretch marks and if they have inelastic skin in that scenario and the excess fat, then the patient would benefit most from an abdominoplasty or a tummy tuck, where you can remove a lot of that skin that has the stretch marks and so forth.
So you can
Some
actually
may
just
be
remove it.
Most of it, yeah.
Oh,
if it's on the
wow.
lower abdomen. But if it extends to the upper part of the abdomen, well, then that will be transferred down to the lower part of the belly area. It won't be up as high. So it depends on where in relationship your incision is and how much you can actually remove the skin.
How do you decide if a patient is able to receive liposuction?
As we evaluate all patients, we look at their medical history to determine whether they would be a candidate for surgery,
But
first of all.
For surgery. But is that in any case?
That's
though?
in any case.
That's in
right.
any case for
Yes,
surgery, right?
Right.
Oh, okay.
So we assess the patient from a medical standpoint
Right.
first. And then we do an examination of the area of concern that the patient wishes to improve.
Is there a case where you will not liposuction because of a person's weight?
Yes, there are different obesity scales that we look at. Those patients that are overweight, patients that are obese, patients that are morbidly obese. If they're morbidly obese, the answer is no.
They can't receive liposuction
because
at all?
because,
No liposuction?
Right, because for a few reasons. First of all, they're high-risk patients for a cosmetic procedure, elective operation. So they may have cardiac issues, they may have high blood pressure issues, they may have diabetes, because this is purely a cosmetic operation.
So it's not, it means
it's not essential.
It's not necessary,
Exactly.
right?
Secondly, if you have someone that is morbidly obese, then that patient has so much fat that even liposuction in a small area is not going to make much of a difference in their final contour. So they have a lot of other issues going on that would require a weight loss program prior to the operation. And then the other circumstance where a patient would not benefit from liposuction is one that there are some patients that have fat that's around the organs in your body.
Right. Oh,
and the fat's not on the outside, so you can't really liposuction the fat. So they may present in a protuberant abdomen, and then they want liposuction, but actually the fat is internal around the organs, and it's not on the outside.
But can you
of the
see
fat.
that? Can you see like if the fat is like does
On
it display?
examination, yes. Well,
It
and
displays?
you could just do like a pinch test. You basically
Oh.
grab the fat tissue and you can
Right.
kind of pinch it.
Uh-huh.
And once you pinch it between your fingers, you can take a caliper, measure it, and then divide it in half. And then you can determine how much fat is on the outside of the body versus the fat that's causing the protuberance of the abdomen.
Right.
That's inside around your organs. So that's another part of the assessment of the evaluation.
And you can't remove that for liposuction? You
No,
can't
because-
remove the fat
because-
around the organs?
No, because, well, if you do an operation, you
Right.
can remove fat, but that's not what we do.
Right.
We only remove the fat that's external, outside of the abdominal wall. And that's called
Okay.
visceral fat. That's fat that's around the organs.
Staying on this topic of weight, what happens if a patient gains weight after liposuction?
So the fat cells and the fat is removed through the cannula,
Right.
but there's some fat that's left behind.
Mm.
That those fat cells can increase in size, but it may not be the predominant area where they're going to gain that weight. They may gain it in other parts of the body, and they can also gain it around the organs.
Mhm. The patient can still gain weight after
Oh,
liposuction.
absolutely.
And it can, I mean, they have to manage themselves and what they eat so that they don't gain weight again.
Right.
I mean, liposuction isn't a cure-all.
If you're looking to lose weight with liposuction, that is not the ideal method because you're not going to lose a whole lot of weight from liposuction.
Really?
You will improve the contour
Mm.
through liposuction, and that's basically the indication for liposuction is to improve the contour of the body. That is why it is best to have a patient reach their goal weight, lose the weight first, get down to a reasonable weight.
Right.
Because if you lose weight, some people will lose weight, but there are certain parts of the body they can't lose that weight.
Mm.
They try to, and they have that excess fat
Right.
in areas, and that's where the liposuction comes in to help those patients.
What are the complications related to liposuction?
So, as with any other operation, infection is a possibility. It's relatively low.
Mm.
You'll have small scars. You can have some bleeding underneath the tissues. That's why we use that fluid, as I mentioned before, to help reduce the risk of bleeding.
Mm.
There may be some irregularities of the skin, especially if it's done very superficial, and in areas where there isn't as much rebound. For example, the abdominal wall, if you liposuction that area, you have to be very careful because as you liposuction the abdomen, it could leave you with areas of depression after you're finished because of the skin rebound to the abdominal wall. It may not be sufficient. There are other potential complications which are relatively low. You can actually inject fat into the blood vessels, and that fat can go to your lungs. And you can die from that.
We
or you can
talked
go to your
about that, I
brain.
think, right?
Yes.
But like
From
oh,
fat
wow.
grafting, right?
Right, from fat grafting.
Right.
Wow, and that can happen with liposuction though, where
It can happen with
actually-
liposuction, yeah. It can happen
and
with
that's like
liposuction.
accidental.
Accidental,
Right.
right. So fat can enter those areas. You
And-
may have some bruising. The other thing
Right.
is that you can also have a puncture to your organs. I mean, if you're doing the abdominal wall, you have to be very careful with the angulation that you're putting
the
your
cannula?
cannula. As I
Right.
mentioned before, you like to stay in that intermediate zone with the fat. But as you point the cannula and you increase your angle,
Mhm.
especially when you're liposuction from the bottom and you're moving it towards the head, you want to make sure that angle is proper. Just to contour the abdomen the way it is as you go towards the head,
Mhm.
you can easily penetrate the abdominal wall and you can puncture
Organs,
like a liver
right?
or a spleen
Right.
or a bowel. you know.
Wow.
So these are the things that we actually look for.
Are cannulas just used with liposuction? Is that the only kind of like machine that's used?
So there's a standard assisted liposuction where we use the cannula.
Right.
It's a hollow tube, has a
Right.
hole or two or three. It's
like a
Several
vacuum.
holes, right?
It's
Exactly,
just like a
vacuum, and you
vacuum.
suction up the
Right.
fat with that. Sometimes you can use a syringe. You can
Mhm.
put a syringe, and you can draw the syringe back. There's a little piston in the syringe.
Mm.
And that can serve as your suction. And there are other devices that have energy that's transmitted into the cannula to improve your ability to remove fat. One is called a power-assisted liposuction, which is a vibrating cannula that moves back and forth much more rapidly than your hand can go back
Right.
and forth, and it actually breaks up the fat mechanically,
Mhm.
and that's drawn out.
And is that easier to remove the fat
Oh,
with
yeah.
that method? Oh, really?
Absolutely. Yeah,
Wow.
absolutely. You can take out a lot of fat with that. You can use an ultrasonic liposuction where the tip is vibrating at a very, very high frequency. That actually lyses the fat tissue. It breaks the fat up. It almost liquefies it
Right.
to the point where as you're pulling the fat out, it's almost like liquid coming
Wow.
out. Yeah. And then other methods are laser-assisted liposuction where you put a little cannula inside and it sends out a thermal injury to the tissues and it breaks up the fat. It's
So
called a laser. It's
all-
like a
All these machines basically are meant to break up
The fat, right,
right,
exactly.
before actually like sucking it out.
Exactly.
I assume it's a lot easier, like you said, when it's all broken up to suck it out.
Exactly.
Okay.
Especially in very dense areas. It all depends on the comfort level of the surgeon as to whether they're going to use one of those treatment modalities.
That is all for this week's episode of the Plastic Surgery Podcast. Thank you all for watching. Make sure to subscribe. We will be back, not next week, but very soon. So stay tuned.